Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're glad you joined us. Before we begin, I'd like to thank our sponsor, Altman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Jenna Davidson, a registered dietitian and licensed dietitian nutritionist with Altman Alliance Community Hospital. Good morning, Jenna, and welcome to the show.
Good morning. Thank you for having me.
All right. We'd like to remind our listeners that our program is available today on our podcast. So please use your favorite podcast app and look for Health Matters with the Medicine Center Pharmacy. And we'd love it if you could subscribe to our program. So March is National Nutrition Month, and that aims to promote healthy eating habits, raise awareness about the importance of nutrition. The goal is to encourage people to make informed choices, improve their dietary patterns, and prioritize their overall health and well-being.
Good morning again, Jenna. Please tell us about your background and training and how long you've been at Altman.
Yes, so I have been a dietitian going on 5 years now. I received my bachelor's degree in nutrition and dietetics from the University of Akron. I started my career at a long-term care and rehabilitation facility and also worked at a personal training gym where I met with members one-on-one for nutrition education. I started working with Altman in 2020. I currently work in both the clinical and outpatient worlds. At the hospital, we are consulted for various things, including nutrition education, malnutrition, and tube feedings or TPNs. I also work in the meds clinic where I see patients one-on-one, assisting mainly with diabetes management, but also the management of other conditions such as kidney disease, celiac disease, and also assistance with weight loss.
Okay, here's the toughest question of the day.
Okay.
What is a healthy diet?
So a healthy diet is one that is well balanced, including a variety of fruits and vegetables, whole grains, and lean protein sources, while also limiting unhealthy fats, added sugars, and sodium intakes.
Gee, and that's all you're going to tell me, huh?
That's the simple answer.
Okay. All right. Very good.
All right, well, here's another loaded question because it has a million answers. How many calories should people consume each day?
Yes, so there is unfortunately not a simple answer for this question because there are multiple factors that affect the number of calories your body needs each day, including age, gender, activity level, and also your personal health goals. There are multiple calorie calculators online, but they may not be personalized to your health goals. One that may be helpful is on myplate.gov. There is a calorie calculator to help you determine a good calorie range for you. But for more personalized calorie and macronutrient recommendations, I do recommend to see a dietitian.
Okay. That's a fair answer. As challenging as it can be, since we're all a little different.
Yes.
What are some of the most common nutritional mistakes people make?
So, one of the most common nutrition mistakes I see people make is cutting out entire food groups. When you cut out an entire food group, you could also be missing out on the essential vitamins, minerals, fiber, and antioxidants that they may contain. Many individuals often omit entire food groups in an effort to lose weight. Though for most people, this is not a diet that can be sustainable for a lifetime. So rather than cutting out entire food groups, I do recommend to focus on the healthier options in each. So for instance, rather than cutting out all carbohydrates, try focusing on our whole grain carbohydrates sources instead. Another common mistake I often see people make is making too many changes at once. It is very common for individuals to have an all or nothing mindset when it comes to their diet. I typically try to encourage my patients to focus on 1 to 2 small changes or goals. And when we have succeeded with those, then we move on to the next. Too often, individuals make multiple changes at once and become burnout or overwhelmed. So it is important to start with small changes and build on them, as we want these to be changes we make for a lifetime, not just for a short period of time.
Um, so what are a few of the most important things to look for on a nutrition label?
Great question. So, the nutrition label as a whole is something very important to pay attention to, but can also be confusing for some people when we don't know what exactly we're looking at. What to focus on when looking at food labels is going to depend on your personal health goals. Two of the nutrients that I tend to tell my patients to focus on for overall health are going to be sodium and added sugars. So, in terms of sodium, it is recommended to limit your sodium intakes to less than 2,300 milligrams a day. Most Americans are consuming much, much more than that each day. If you have a condition where sodium intake is recommended to be limited for the management of that condition, your daily intake is often going to be lower than that 2,300 milligram range.
Jeez.
Yeah.
You eat a bag
Added sugars.
you eat a bag of potato chips, you're in big trouble.
Exactly. Yes.
God.
And then any type of processed foods, anything prepackaged, those typically
Mm.
pack a lot of sodium as well.
I love potato chips. Okay. How can healthy eating be more affordable?
So I get this question often. Healthy eating does not have to be expensive. Consuming fruits, vegetables, whole grains, lean proteins, low fat dairy, and healthy oils in any form can fit into a healthy eating pattern. First and foremost, I recommend we cook more and eat out less. Eating out, whether it be at a restaurant or a fast food place, can be quite pricey. Many foods can often be made at home for less money and typically more healthfully. If you find yourself spending an increased amount of money on fresh fruits and vegetables, I do recommend to try and focus on the produce that is in season, which often costs less and is at peak flavor. You can also try frozen options. I just recommend to do those without the added butter or sauces. These are going to be just as nutrient dense as the fresh options. Canned fruits and vegetables are also a perfectly fine option, but we do want to look for the canned vegetables with no salt added or that are low in sodium. And then fruit cups or canned fruit, we want to look for in water or 100% fruit juice rather than the sugary syrups.
You know, some of the grocery stores, you walk in the front door and there's a ton of fresh fruit across the, looking at you, and I really like fresh fruit. How much can I eat? Pineapple, strawberries, apples, grapes, you name it. Okay.
Yeah. Typically, the serving size is going to be about a cup. It is going to vary from person to person how much you can eat each day, but one single serving size is going to be about a cup.
Oh, now you eat more than that.
Yeah.
The doggone fresh fruit does raise your blood glucose.
It does, yes. It has natural sugars in it, but a benefit of fresh fruit is it also is high in fiber. So fiber takes longer to digest. So that kind of indirectly helps with your blood sugar because it takes longer to digest. So we're slowing that glucose uptake into our bloodstream.
Okay. Of the fresh fruits, we never used to see watermelon in the winter months and cantaloupe and all that kind of stuff. And pineapple, fresh pineapple. I'm thinking, wow, what's the best?
What's the best nutritionally or?
Nutritionally, I know what tastes the best. It's the pineapple. It's a winner. Okay.
So really, there's no one best fruit option. All of them are perfectly fine to include in your diet. Some are going to be a little bit higher in fiber than others. So some with skins are going to be higher in fiber. The skin is going to contain an increased amount of fiber. But there's really no one best fruit source.
Yeah, I like it all. I really
Yeah.
do. I really do. It is hard to pass by that
Uh-huh.
and not grab some of it. And it's not
So in
it's not cheap. It's expensive, that fresh stuff.
it can be a little expensive. That's why we recommend, I know in Ohio it's a little bit complicated sometimes with fruits, but trying
Mhm.
to focus on the in-season produce as much as you can.
All right. Okay.
But in terms of some other recommendations, to save money when we're trying to eat healthy with whole grain foods. So, rice, quinoa, oats, these can be purchased plain and uncooked in larger
Mhm.
quantities. And typically, you get more servings per dollar than your prepackaged options. Protein options, you can buy beans, peas, lentils, canned tuna, salmon, sardines if you like those options. Those are typically lower in cost. And then one thing I do like to focus on is beverages. Water over everything. We do want to try and limit the sodas that are high in sugar or any other beverages that are high in sugar and calories. Those are also going to be very costly. So it is much more cost friendly to focus on water.
Okay. First break here.
Yep.
Okay, our first break is here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. Are you ready for vaccine season? Stop in or schedule your flu, pneumonia, COVID, or shingles vaccine online at medshoprx.com.
All right, Jenna, it's time to go down the rabbit hole. So, a couple things. First thing is breakfast really the most important meal of the day?
So, breakfast is indeed an important meal, but typically what you choose for breakfast may be even more important. Eating breakfast is going to provide you with energy to power through the morning. It kickstarts your metabolism, can assist in avoiding weight gain. So, we kind of like to think of it as a car, for example. Would you begin a road trip with your gas tank on E? Typically, the answer is no. So, the same goes for your body. It requires fuel for energy. But when discussing healthy breakfast options, it is important to include a good source of protein and whole grains into this meal. Some options may include an egg, turkey sausage, and veggie breakfast burrito on a whole wheat tortilla. One hard boiled egg and two slices of whole grain toast with some peanut butter, or even some old fashioned oats topped with fresh fruit and chopped pecans. If you struggle with eating a morning meal, I recommend starting with something small, such as a protein shake or a no added sugar yogurt or a high protein smoothie.
Okay,
All
interesting.
right. So, this kind of begs another question, and it's probably a whole separate program. But I have to ask about the fasting camp. So, those that are looking to do the 12-hour fast, I'm going to guess more often than not are skipping breakfast and they're only eating in their 8-hour window. How does that fit into a healthy diet plan?
So we could talk a while about this, but to kind of just talk about it briefly, um, fasting does work for some individuals, but it is one of those things that what works for someone doesn't mean it's going to work for you as well. So it's not something that I typically recommend. But as far as fasting goes, when we go long periods of time without eating, we're actually slowing down the rate at which our body is burning calories. So it is typically recommended just to eat consistently throughout the day.
Okay. So, what do you think about a ketogenic diet?
Okay, so the simple answer is I do not feel that the ketogenic diet is sustainable for most individuals. As most of us are probably familiar due to the popularity of this diet, the ketogenic diet is comprised of high fat, very low carbohydrate intakes. Many individuals do experience a quick weight loss, which is initially in the form of water weight. Now,
Mm.
while you may see results in the short term, this is not a diet I would recommend due to its restrictive guidelines. When we restrict a major food group from our diet, like carbohydrates in the ketogenic diet, we are also missing out on the important nutrients that those foods have to offer. So, our complex carbohydrates provide us with a lot of fiber, vitamins, and minerals that are essential to the body. So, due to its restrictive nature, this diet is often difficult to follow and tends to be overwhelming for many individuals, leading to frustration and just reverting back to prior eating habits. I do not believe that there is a diet perfect for everyone. The ketogenic diet works for some, but like I said previously, what works for one person may not work for you, and that is perfectly okay. My goal as a dietitian is to help you establish lifelong, sustainable, healthy habits. And due to the restrictive nature and the high intakes of unhealthy fats that the ketogenic diet is comprised of, it is not something that I typically recommend for most individuals.
Interesting.
All right. So as we talk about, there's 100 different diets out there, but what about more plant-based diets? What benefits could those have for you?
Yeah, great question. So, a plant based diet does have many health benefits. There's been a lot of research done, and research has shown that a plant based diet can lower your risk of heart disease, hypertension, diabetes, digestive disease, obesity, and also some types of cancer. Plant-based diets can be well balanced, though if not well planned, you may risk not meeting your protein, vitamin, and mineral needs. So it is important to include a plant-based protein, fruit, vegetables, plant-based fat, and whole grains into each of your meals each day. Some great options for plant-based protein sources include things like tofu, quinoa, lentils, chickpeas, nuts and seeds, and beans. If you follow a plant-based diet, be sure to follow with your primary care doctor annually to have your labs drawn just to assess for any vitamin deficiencies. And another recommendation, if you are trying to consider switching to a more plant-based diet, just remember to start with small changes and consider meeting with a dietitian to ensure that you meet your nutritional needs.
Okay, here's a hot question too. Well, what is the best diet to follow?
So, the best diet to follow is one that works best for you while also meeting your nutritional needs. It is important to follow a diet that can be maintained long term rather than just for a short period of time. Eating large quantities of certain foods, drastically cutting calories, or eliminating entire food groups can cause nutritional deficiencies. And diets surrounding these are typically not sustainable for a lifetime. A diet should include foods that you would enjoy eating for a lifetime. If a diet is comprised of foods you don't like eating or is over restrictive, it is probably not something you will stick with long term. So, the best diet is going to be the one that aligns with your specific health goals, food preferences, and fits into your lifestyle. There is truly no one size fits all when it comes to the diet.
Best sources of protein.
There are many great sources of protein. Protein is an essential nutrient in the diet. Anytime your body is growing or repairing itself, protein is going to be needed. It can be found in both animal and plant-based foods. Some protein sources are considered better choices when discussing overall heart health. So our high-fat protein sources, such as bacon, sausage, and deli meats, contain saturated fats, which may increase the risk of heart disease. So those are some that we do want to try and limit. It is recommended to focus on more leaner protein sources. So things like skinless turkey and chicken, pork loins, lean cuts of beef, salmon, tuna, low-fat and fat-free dairy products, and then some plant-based protein sources that we talked about earlier. So beans, nuts and seeds, tofu, things like that.
So what about carbohydrates? Are they bad? Are the carbohydrates healthier than others? Some healthier than others?
So carbohydrates are not bad at all. Carbohydrates are not the enemy, as many people think they are. Carbohydrates are the body and the brain's main source of energy. They are broken down into glucose, which is the body's and the brain's preferred source of fuel. So, although not all carbohydrates are created equal, it is important to limit our simple carbohydrate sources, such as sugary beverages, white breads, pastries, and desserts, and focus more on our complex carbohydrate sources. So, our complex carbohydrates contain more fiber and protein and are digested more slowly, providing sustained energy and nutrients, and they're going to keep you fuller for longer, as opposed to our more simple carbohydrates. So, some examples of some complex carbohydrates that you may want to include in your diet are going to be whole grain breads and pastas, brown rices, fruits, and vegetables. And we do recommend to try and make at least half of your carbohydrate intakes each day come from whole grain foods.
Gosh. Okay.
So, what about organic? Can you talk a little bit about what organic foods are and maybe potentially why they could be healthier for you?
Yeah, of course. So, organic is a USDA defined labeling term that relates to the way foods are produced rather than their actual nutritional value. There is not strong evidence showing that organically produced foods are higher in nutrients. Choosing organic foods is pretty much a personal decision. If your goal is to limit exposure to pesticides, antibiotics, and hormones, or if you have concerns about environmental impact, then organic foods may be the right choice for you. However, it is not certain that eating organic foods will actually make a difference in your overall health. One concern that people do often have with organic foods is the cost. They're often not very feasible for many individuals. One thing I would recommend if you are interested in buying more organic foods is to start with the items on the Dirty Dozen list, which are produce items with the highest number of pesticides. Strawberries being at one of the highest ones. But the bottom line is no matter if you're buying organic or conventionally grown produce, washing your produce is going to be very, very important to reduce the risk of foodborne illnesses. And washing with cool tap water can do the trick.
Okay. It is bottom of the hour time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning we are talking with Jenna Davidson, a licensed dietitian, nutritionist with Altman Alliance Community Hospital. That's a big line. Okay.
All right, before the news break, we talked about some organic foods and tips on that. What about your thoughts on raw or unpasteurized foods?
Great question. This has been a hot topic on the internet and social media lately, with unpasteurized milk being the focus, claiming to boost the immune system, reduce the risk of respiratory infections and allergies, and multiple other benefit claims. Bottom line is there is no reliable scientific evidence supporting these claims. The perceived benefit of raw or unpasteurized products have not shown any scientific validity, though the risks of foodborne illness are very, very clear. Pasteurization is a process used in some food products, such as our milks, to kill bacteria without significantly affecting the taste and nutritional value of the product. Illnesses caused by bacteria that can be present in unpasteurized products can be especially problematic in high-risk populations such as infants, young children, the elderly, anyone who is immunocompromised, and also during pregnancy. So with that said, consuming pasteurized products is much, much safer than consuming unpasteurized products and risking a foodborne illness.
But what about eggs? There's people that have been raising their own eggs. There's a couple in my neighborhood where I live that have a bunch of, I don't know what you call a herd, but a bunch of chickens and producing their eggs that they eat. Eggs are not eggs that you find in the store examined with a light or something like that to look at the, am I wrong on that, or how do they produce those?
I believe so, but I can't say that 100%.
Okay. The current thing about eggs is that they are bad for your brain. And are you catching any of that stuff in the news?
I have not, and I don't know what the relation is to that. I have not, there's nothing that comes to mind that I would think be a correlation to brain health and
Hmm.
eggs.
What I've been currently reading is that the excessive amount of eggs are bad for men's brain. Okay. Now there's a lot of other stuff bad for men's brain too, but but that's what's currently okay. Everything on the internet's true, right? Okay.
Right,
Uh,
everything.
Okay. But that's the latest thing that's been bounced around out there about eggs, and I'm thinking, okay, I like scrambled eggs, okay?
Right. And eggs are a great source of protein. They have great vitamins and minerals in them that are essential for the body. So, in my position as a dietitian, I typically recommend eggs pretty often as a good source of protein. That egg and brain um, thing that's going around right now, I would have to look into. But
Yeah.
it sounds to me like another one of those misinformation,
Yeah.
nutrition misinformation articles that are online
Well,
frequently.
my God, the eggs are the number one thing for breakfast. I mean, really,
Yep.
when you have a cooked and a warm breakfast and stuff like that,
Yes. And
and you have
it is a very easy breakfast option.
eggs and bacon and coffee and toast and da da da. That's the deal. Okay.
Hmm.
Okay. All right. I'll let that one alone.
So, what about supplementing with vitamins and mineral supplements? What's your take on that?
Yeah, so vitamin and mineral supplements are products intended to do just that, supplement the diet. In the presence of a nutrient deficiency, dietary supplements can help you get adequate amounts of essential nutrients. However, supplements should not take the place of a healthy eating routine. For most individuals, it is possible to get 100% of the essential vitamins and minerals from food alone, but there are instances where supplementation is necessary. For individuals like us in Ohio, we don't get a lot of vitamin D during the winter months. So some of us may be deficient in vitamin D. Um, but high dose supplementation can cause toxicity for some vitamins. So, if you have concerns about a vitamin or mineral deficiency, it is important to talk to your healthcare provider prior to adding any supplements into your daily routine.
Hmm. What about seed oils?
Okay.
Another great question, something that has been a hot topic on the internet and social media lately. So, seed oils like canola oil, corn oil, and soybean oils, just to name a few, have
Mhm.
been deemed the hateful eight and demonized on the internet and social media in recent years.
Hmm.
So, is it really the oils themselves that are unhealthy, or is it the items they are being made with? Is the discussion that I think would be most beneficial to review.
Hmm.
It is recommended per the dietary guidelines for Americans and the American Heart Association to focus on our healthy fat sources, which include monounsaturated and polyunsaturated fats. Seed oils contain a polyunsaturated fat called omega 6, which is important for many functions in the body.
Hmm.
So, most seed oils are utilized in ultra processed packaged foods, fast foods, and restaurant food, which is where the problem lies with seed oils. These foods are typically high in added sugars, sodium, refined flours, and low in our health benefiting nutrients such as fiber. So, the bottom line is seed oils can be a part of a healthy, balanced diet when used in a healthful way and consumed in moderation due to their high calorie content. So some healthy ways you may be able to use some seed oils include lightly tossing salads in an oil-based dressing, or lightly using some oil to oven roast vegetables, or saute chicken, fish, or tofu, things like that.
Okay. What are probiotics and prebiotics, and are they beneficial?
So pre and probiotics are very beneficial for our gut health. Research shows they play a key role in promoting good digestion, supporting the immune system, and helping to improve irritable bowel syndrome and diarrhea symptoms. Probiotics are live microorganisms which can be present in food or supplements. These live microorganisms survive in the gut and are intended to maintain or improve the good bacteria in the body. Probiotics can be found in our fermented foods, such as some yogurts, kombucha, tempeh, and sauerkraut. Prebiotics, on the other hand, are essentially function as a food source for the good bacteria in our gut. So prebiotics are non-digestible food components. So when prebiotics make it to the colon, microorganisms metabolize and ferment these prebiotics so that they can survive. So foods with high amounts of prebiotics include things like hickory, garlic, leeks, onion, asparagus, and Jerusalem artichokes. They're also found in lesser amounts in bananas, whole wheat products, yams, and sweet potatoes. So, in terms of supplementing with pre and probiotics, I always encourage food first. But in the event that you do not consume foods with a lot of pro and prebiotics, a supplement may be beneficial for you.
Okay. How do you feel about the meal service companies that make pre-made meals or meal kits?
So there are many great options for meal delivery services available nowadays. Some even with meals designed or approved by a registered dietitian. Many offer a variety of dietary needs, preferences, and common food allergies as well. Although not all meal delivery services are created equal, it is important to be aware of the food labels for the meals you're choosing, as some may be very high in calories, saturated fat, and or sodium. So what I recommend when researching the different meal delivery companies or simply just looking at the meals that they offer is to look for one that focuses on lean protein sources, whole grains, healthy fats, and fruits and vegetables.
Okay. Time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thank you for joining us. Let's get back to the last segment of the show. So, Jenna, how can people avoid nutrition misinformation? What resources do you recommend and consider trustworthy for learning more about nutrition?
So, this is a great question to review because it can be very complicated to sift through the mass amounts of nutrition misinformation that is on the internet and social media nowadays. I have had multiple patients come to me very frustrated and confused with what to eat, or simply saying, I can't eat anything because of the misinformation that they read on the internet. So, when it comes to nutrition information, it is important to consider the source of the information. Is it coming from science based research being reported by an expert in that area, or is it merely an opinion from an influencer? So, some red flags to look for when we're looking at nutrition information, they are promising quick fixes. If it sounds too good to be true, it probably is. They are promoting a diet that excludes an entire food group. As we talked before, we don't want to cut out an entire food group because we may be missing out on the essential vitamins and minerals that are included in that food group. They are labeling foods as good or bad foods. And also, if they are simply a social media influencer, Although their content is entertaining, they are often paid by companies to promote products, and this does not make them an expert in nutrition. So, some websites that we can look at for reliable nutrition information, we want to look for websites that end in edu, gov, or org. These tend to be more reliable sources. For reliable nutrition information, check out myplate.gov or the Academy of Nutrition and Dietetics at eatright.org. You can also find disease-specific nutrition information on health organizations' specific websites, such as the American Heart Association at heart.org or the American Diabetes Association at diabetes.org. And of course, as always, for individualized nutrition advice, I do always recommend to meet with a credentialed registered dietitian nutritionist.
What would be the best way for people to keep track of what they eat?
So, keeping a food journal can make tracking what you are eating much easier. You can always go with the pen and paper route if that's easiest for you, but there are also multiple apps for smartphones that can make this method simplified for you. For some individuals, keeping a food journal can assist in staying on track with a weight loss journey, though it can also help to identify food intolerances or sensitivities and can result in more mindful eating practices. Anyone can benefit from keeping a food journal, though if it adds additional stress, try to focus on something more generalized, such as focusing on journaling protein foods or beverages only, and continuing to build on that as it becomes a little bit easier. If keeping a food journal is something that you're interested in, one app I do frequently recommend that is pretty user-friendly is called MyFitnessPal.
Interesting.
All right, you've given us some amazing information this morning, but I'm guessing that there's something that as a registered dietitian, you just wish everybody knew. So what would that be?
So there is a lot I could say that I wish everyone knew, but simply when it comes to nutrition, many people often look for a quick fix. A healthy diet is a lifestyle. Weight loss is not going to happen overnight, and nutrition does not have to be overly complicated. There is no, like I said previously, there is no one size fits all plan for each person.
You know, I think that the word diet sometimes gets a bad name, and I would guess you would agree because it automatically makes you think of restrictions and you can't have and things of that nature. And I wanted to share a fun story, and I bet you have multiple stories that you might be able to share, and you're welcome to. But I had a story in the last week at the pharmacy where I talked to a patient who is on a weight loss journey, and he's working with a doctor to do it. But his most amazing takeaway that he shared with me was that in the first month, he lost 15 pounds. And he lost 15 pounds simply by cutting out the 2 liter of Mountain Dew he drank every day.
Oh, God.
So, you know, you talked earlier about what you drink. Don't underestimate the sugar and the crap that is in what you drink. So just think about that. If you're a big carbonated beverage drinker, that was pretty stunning for me. So.
Yes, that is one of the first things I typically focus on and ask my patients, especially my diabetics. What do you drink? Because oftentimes that is going to be correlated to a large spike in your blood sugar. So frequently that is one of the first things we talk about. Let's try to switch to something that is not going to have sugar in it.
You know what? We haven't talked about sugar substitutes today. And stevia is getting a bad name now, and a bunch of others getting a bad name. I'm just thinking, what is going on here? Stevia is from a plant, okay? What do you think?
I had a feeling this question would come up. It is a very common question I get as well, because oftentimes, because of the misinformation that is on the internet or social media. In my practice, I know other dietitians have different opinions. I typically do recommend the diet or sugar-free products over the regular products, especially in an attempt to help better control the blood sugar. As far as stevia goes and monk fruit, I also typically recommend those as a more natural alternative. Um, but I know there's other dietitians that feel differently. But there is so much misinformation when it comes to sugar substitutes. Most of the research that is out there currently is not done on human subjects. So there does need to be much more research done on artificial sweeteners and things like stevia and everything like that. But as of now, all of these products are generally recognized as safe by the FDA.
You know what we didn't talk about today was reducing your intake of food to lose weight. And I did that, and I lost a lot of weight.
Yeah.
Yeah.
Portion size is
Yeah.
a huge thing.
Yeah. Some of these people sit down at the table and eat 2 steaks, and it's just absolutely unbelievable. All right, okay, we're very tight on time. So one more question. Do you have seminars at the Alliance or for people group?
So, not necessarily seminars, but I do take individuals for one-on-one nutrition education. I do just need a referral from a physician sent over to the hospital, and scheduling will typically go through our centralized scheduling department or our meds clinics.
Okay.
As we wrap up, is there anything else you want to add before we head out?
No, I think that was everything. Just one big takeaway that I hope everyone listening comes out of this with is I hope after listening, if you are ever feeling overwhelmed or confused about nutrition, that everyone reaches out to a registered dietitian, because truly nutrition does not have to be as complicated as we sometimes make it.
Wow. Okay, we need more time with you. Like to have you back again sometime.
I would be happy to talk again.
Very good. Okay. Thank you to our guest, Jenna Davidson, RDNLDN. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Altman Health System and our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. And thank you very much, Jenna. It's been very interesting. Okay.
Thank you.
Thank you very much. Have a good day.